Hello everyone. Let's continue beta-lactamase antibiotics. Last class we have studied these drugs, and we have known beta-lactamase includes penicillins and cephalosporins and other beta-lactam antibiotics. Because these drugs have the same basic molecular group, beta-lactam, so we put them together, and they share the same mechanisms inhibit cell wall synthesis. And last class, we have studied the first kind, penicillins. And we also have known penicillins includes these different subtypes. The first kind, natural penicillin, penicillin Z. Last class, we have studied penicillin Z's pharmacological effects can kill gram-positive cocci and bacillus, also kill some gram-negative cocci and spirocheta. We use penicillin G to treat sensitive bacterial infection as the first choice agent. The major adverse action of penicillin Z is allergic reactions. We have known allergic reaction, so at first ask a history, second do the skin test, and third one should prepare the drugs, adrenaline to save the life. This is the narrow spectrum penicillin Z. But penicillin Z we couldn't oral administration, so we add a new group in penicillin Z. We have the second step, second kind penicillin, semi-synthetic penicillin, such as acid-stable penicillin. So let's continue the class. Acid-stable penicillin. Acid-stable penicillin, because penicillin Z, non-acid stable, couldn't oral administration, and we use semi-synthetic penicillins in clinic. Acid-stable penicillins, such as penicillin V, such as penicillin, and these drugs, especially the most widely used drug in this type is penicillin V. Penicillin V's antibiotic action similar to penicillin Z, so inhibit on the kill positive, negative, positive, gram-positive cocci and bacillus, gram-negative cocci and spirocheta. We use penicillin V because the drug is acid stable. Acid stable means we can oral administration. Oral administration penicillin is this one, penicillin V, because it is acid stable. But use penicillin V several days to 1 week, and then drug ineffectiveness because drug resistance. So non-penicillinase resistance. Clinical using of penicillin V similar to penicillin G. So used to treat sensitive bacterial infection, positive cocci, positive bacillus, and negative cocci infection. But this drug, oral administration. So that means mild patients, mild positive cocci, moderate positive bacillus infection. So mild pneumococci or streptococci infection, we use oral administration drug is this one, penicillin V. Adverse action of penicillin V. Adverse action compared to penicillin Z, because penicillin Z must intramuscular or intravenous injection. So the adverse action is allergic reaction. Same with penicillin Z, penicillin V allergic response, but a mild allergic reaction. Some patients maybe use the drug, skin rash, mild patients, and no problem. So they use penicillin V, they don't use skin test. Okay, so in clinic, we have lots of different penicillin V made in different drug company. So this one is penicillin V, penicillin V, penicillin V. And you stay in China, so you study in China, and you should know penicillin in Chinese 青霉素，青霉素，青霉素 penicillin. Next class we will study erythromycin, means 红霉素. So in China we call the antibiotics they are 霉素，霉素 penicillin is 青霉素。So penicillin V is 青霉素 V, 青霉素 V. We can oral administration. So next time, if you have the patients or if you mild infection, you can use oral administration antibiotics such as this one, penicillin V, 青霉素 V. But we use penicillin V several days or one week, and then drug resistance. So we add a new group in penicillin, and then we have penicillinase resistant penicillins. The drugs include oxacillin, cloxacillin, dicloxacillin, and flucloxacillin. These drugs, they are penicillinase resistant penicillins. And these drugs have these two feeders. The first feeder, acid stable. What's the meaning acid stable? Means that we can oral administration. Can oral administration oxacillin or cloxacillin, dicloxacillin. And the second feeder is penicillinase resistance. Means use the drug and the drug resistance occurs very late. So clinical using of this drug resistance means the patients use penicillin G or penicillin V or other penicillins and then drug resistance. So we can change the drug, change penicillin G or V into oxacillin. So used in penicillin resistance patients. Idle section, similar to penicillin G, so the same idle section. Allergic reactions. Allergic reactions, mild patients show skin rash. But if the patients use this drug, intravenous using, they should, the first one, do the skin test. Do ask a history. The second one, do the skin test. And the third one, prepare the drugs to save the life. Okay? So the adult section. And just now we mentioned these drugs, penicillin G or penicillin V or oxacillin. And these drugs, they are narrow spectrum and bactericidal drugs. So we add a new group in penicillins and extend spectrum. So we have the broad spectrum penicillins such as ampicillin, amoxicillin, and P1-penicillin. Chinese name, this one, because this drug is widely used in clinic. Amoxicillin, Chinese name 阿莫西林 amoxicillin. And the first feeder of amoxicillin is the acid stable. So we can oral administration amoxicillin or ampicillin. The second feeder is non-penicillinase resistant. What's the meaning? Oh, use amoxicillin several days, 1 to 2 weeks later, drug resistance occurs. Yeah. And the third one, the third feeder, can against gram-positive cocci bacillus, gram-negative cocci, and gram-negative bacillus. So compared to penicillin, other penicillins, amoxicillin, ampicillin, and their antibacterial spectrum is enlarged, so they are broad spectrum penicillins. The drug is amoxicillin and ampicillin. But this drug still couldn't kill Pseudomonas, so we add a new group in amoxicillin, and then we have the fourth kind of semi-synthetic penicillins, we call them antipseudomonas, broad-spectrum penicillins. Includes carbonicillin, sulbonicillin, ticagrelin, furbenicillin, argocillin, and piperacillin. These drugs, such as carbonicillin, these drugs, their bacterial spectrum similar to that of ampicillin, amoxicillin, broad spectrum. In addition, these drugs are effective against kill pseudomonas. So that means in clinic we use carbonicillin or sulbonicillin mainly used to treat pseudomonas infection. So now I have a question. Do you know which kind of patients they are pseudomonas infection patients? Or we change the sentence, the question again. Which kind of patients they always infect pseudomonas? Do you know which kind of patients? Born infection. Born infection. So that means the clinical using, we use carbonicillin, sulbonicillin used to treat serious infections. Serious infections, especially pseudomonas infection, especially burn infections, because burn patients always infect pseudomonas. So burn infections, we use carbonicillin or sulbonicillin. Okay, so the number 4. Just now, we studied these semi-synthetic penicillins. And last class, we studied natural penicillin G, narrow spectrum penicillin. And then we studied acid stable penicillin weakened oral administration. And the second semi-synthetic penicillins, cloxacillin, oxacillin, acid stable, and penicillin resistance. We call them penicillin resistance penicillins. And then we have ampicillin and amoxicillin. Compared to penicillin G, this drug can oral administration and broad spectrum penicillins. At last, we have the last kind, especially kill pseudomonas, so we call them antipseudomonas, broad spectrum penicillins. Okay, so this class we studied the first kind of beta-lactamase penicillins, and in beta-lactamase also includes cephalosporins. Okay, cephalosporins. Why we put cephalosporins and penicillin in the same kind? Because they share the same basic molecular groups and beta-lactamase. And the cephalosporins here add new groups will have new different cephalosporins. So can you understand here? In here, especially in our class, some students who study pharmacy in China. So different group in here, and then we'll have different cephalosporins. Okay. So we have different cephalosporins, and we divide cephalosporins into 4 generations. The first generation cephalosporins, the oldest cephalosporins, and we still use them in clinic, such as cephalocin, cephadrolin, and cephadine. So do you know in China, just now we studied penicillin. I have told you we call them 青霉素. And do you know this one, cephalosporins, 头孢霉素. And this one is cephadrolin, 头孢唑林, cephadine, 头孢拉定. So we call cephalosporins 头孢. Understand? 头孢. Second generation cephalosporins include such as cyphaloponidol, cephalosporin, cephalosporin, and this one is 头孢克洛. And these two drugs are widely used in clinic in the second generation cephalosporins. And then we have the third generation cephalosporins, such as cefotaxime, ceftriaxone. And this one, ceftriaxone, is the most widely used antibiotics in the world in each country. So this drug is ceftriaxone. Chinese name is 头孢曲松, ceftriaxone, 头孢曲松. It is the most widely used agent in the world in clinic. And this year we have the fourth generation cephalosporins, such as cephalosporin, 头孢媲美, and cephalosporin, 头孢破落, and cephalidin, and so on. So we divide cephalosporins into these four generations. Cephalosporins and penicillins, they share the same mechanism. Do you remember? Yes. Inhibit cell wall. Yes. Cephalosporins can inhibit bacterial cell wall synthesis in a manner similar to that of penicillins and are considered bactericidal agents. So, compared to penicillin, in fact, cephalosporins and penicillin, they are same kind. They are beta-lactamase because they share the same mechanism. Compared to penicillin, cephalosporins means more powerful, more expensive, and higher efficacy, lower adverse reaction. But they are same kind. Okay, they are same kind, so they share the same pharmacological effects. Cephalosporins share the same mechanism, share the same adverse reactions with penicillin. So that means cephalosporins, yes, have the same adverse reaction. The most common adverse reaction is allergic reaction. Okay. The pharmacological effects of cephalosporins. The first one, just now we divide cephalosporins divided into four generations. The cephalosporins are effective against a wide variety of gram-positive and gram-negative microorganisms. So the antibacterial spectrum broader, wider than penicillin. Cephalosporin and cephalosporin, they are in the third kind, they are third generation. Okay, the third generation cephalosporins are effective against the Pseudomonas aeruginosa. So this bacterial infection, we use the third generation cephalosporins. Clinical using. The first generation cephalosporins mainly kill gram-positive, even includes penicillin resistance as errors. So clinical using very easy. The first generation cephalosporins mainly used to treat gram-positive bacterial infection, including gram-positive respiratory infection, urinary tract infection, and gastric intestinal infection, and so on. So clinical using of the first generation cephalosporins is gram-positive infection. The second generation cephalosporins can kill gram-positive, also kill gram-negative. So clinical using used to treat pneumonia, biliary urinary tract infections. In fact, the second generation cephalosporins mainly used to treat gram-positive and gram-negative mixed infection. So some patients, maybe we don't know, in fact, gram-positive or gram-negative, we don't know. So we can give the second generation cephalosporins. Or some patients, they in fact are gram-positive, both gram-positive and negative. We can give the second generation cephalosporins, such as cephalosporin 头孢克沃 these two versions. And the third generation. The third generation cephalosporins mainly kill gram-negative. So clinical using very easy. Gram-negative infection, we use the third generation cephalosporins. So such as urinary tract infection, pneumonia, bacterial meningitis, and septicemia, and Pseudomonas aeruginosa infections, we can use the third generation cephalosporins, mainly used to treat gram-negative bacterial infection. So the first generation gram-positive, the second generation mixed, and the third one gram-negative infection. The idle section. Cephalosporins, same kind with penicillins, so they sell the same idle section, allergic reactions. Hypersensitivity reactions. The patients use cephalosporins, especially intravenous using, so nearly 5% of patients, they will have allergic reaction. How to treat to prevent allergic reaction? Same with penicillin. First, ask history. Second, test. Do the skin test. Use cephalosporins. Do the skin test. And third, prepare to save. Use the first choice agent is adrenaline. So same with penicillin. Cross sensitivity reaction with penicillin. What's the meaning cross sensitivity? Means the patients use penicillin have allergic reaction. That means they couldn't use cephalosporins. They use cephalosporins also have allergic reaction. So now you understand what's the meaning cross sensitivity reaction. They cause because penicillins and cephalosporins, they are same kind, beta-lactamase. So they sell the same idle section, hypersensitivity reaction. Use penicillin have allergic reactions. And that also means use cephalosporins also have allergic reactions. We call this cross sensitivity reaction. The third one is renal damage. Renal damage. In fact, only the first generation cephalosporins have this idle section. And here I should confirm. In clinic, have three kinds of antibiotics have obviously nephrotoxicity. The first generation cephalosporins and vancomycin and aminoglycosides. These three kinds of antibiotics have obviously nephrotoxicity, renal damage. That means we should pay attention to 2 points. The first point, the elderly patients, renal function abnormal patients, we shouldn't give the first generation cephalosporins or vancomycin or aminoglycosides. The second point is if we give the first generation cephalosporins or vancomycin or aminoglycoside, we couldn't long-term use because these drugs have renal damage. And we shouldn't co-administrated with these three kinds of drugs. They have obviously nephrotoxicity. Okay? And the last idle section is superinfection. Superinfection, only the third and the fourth generation cephalosporins, because they are broad-spectrum antibiotics because they can kill bacteria. But in our gastric tract have some normal bacteria, also kill this normal bacteria, so induce new infection. This new infection, we call this super infections. Okay, just now we explained the cephalosporins, and this one is the ceftriaxone. Ceftriaxone is the most widely used antibiotics in the clinic. Chinese name is 头孢曲松. 头孢曲松. Okay. Just now we studied 3 generations cephalosporins. First generation mainly kill gram positive. Third generation mainly kill gram negative. The second generation in the middle, so mixed infection. And the beta-lactamase resistance use first generation cephalosporins, several weeks, and 1 to 2 weeks later, no use. And then third generation cephalosporins have strong resistance, so they strong. And the renal damage, only the first generation cephalosporins have nephrotoxicity. The second and the third generation, no this adult section. Oh, maybe you're confused. Oh, teacher, you have forgotten one drug, the fourth generation cephalosporins. Why I don't mention the fourth generation cephalosporins? Now let's explain the fourth generation cephalosporins. Okay. The fourth generation cephalosporins and can kill gram positive. Oh, the strongest, very, very powerful. And also can kill gram negative, very, very, very powerful. More powerful than the third generation. Drug resistance, very strong, higher than any other drugs. Renal damage, no this other section. So, do you know, in fact, the fourth generation cephalosporins? In fact, we shouldn't use the drug as the first choice. That means we have the patients, and we should give penicillin as the first choice. If penicillin no use, we change into cephalosporins. And then if cephalosporins, the first, the second, and the third generation still no use, at last we give the fourth generation cephalosporins. Okay? We give the fourth generation cephalosporins. And because powerful, and that also means most expensive. So don't wait the fourth generation cephalosporins, not as the first choice, should as the last line. Okay, so the questions. Penicillin's mechanism we have studied and just now we reviewed. Inhibit solvol synthesis, pharmacological effects, and adult reaction, allergic reaction. The different properties of 4th-generation cephalosporins. Just now I use this picture how explained. Do you remember? The first-generation cephalosporins, and we can use the drug gram positive, and the third generation gram negative, the second generation positive and negative. So the feeders, clinical using very easy. The last question is the classification and the feeders of semi-synthetic penicillins. Okay. This class we studied cephalosporins and semi-synthetic penicillins. Next class we will study macrolides. Okay, class is over. See you next time.